Hello everybody, this is Rosalind Ziffer again today on this part and this episode. We have talked at length about how you can reverse or prevent type 2 diabetes, and that has been really quite detailed. We talked about lifestyle modification, we talked about exercise as well. So this time we are going not to pretend that there are people who are living actively with diabetes, type 1, type 2 gestational. And so we are going to recognize that and begin to address how you can manage it to prevent long-term complications, to also not allow it to metamorphose into something even more serious than simply diabetes. Okay, so in this part, like I've mentioned, we are going to go into more on how do you manage yourself if you have diabetes, just to prevent long-term complications. Because I like to make very short videos, so I will just like breeze through all the approaches to protecting yourself or managing diabetes. And then on the subsequent episodes, we're going to deal with each and every one of them decisively. So if we have diabetes, the primary aim is to maintain euglycemia, which we call normal blood sugar levels. If we maintain normal blood sugar levels, you will be as good as someone actually without diabetes. You will prevent long-term complications like going blind, like kidney disease, like losing your limbs, like heart disease. So many things you're going to protect yourself against. You'll prevent or delay it. So in that case, you live as normal life as possible, irrespective of the fact that you have diabetes. So this is primarily the thing we focus on when we are addressing diabetes management, and that is really what we need to do. Sometimes you might, when someone gets diagnosed with diabetes, according to Diabetes Canada, the International Diabetes Federation, they do recommend lifestyle modification, especially for type 2s. But if you have type 1, you are automatically started on insulin injection. We will deal with those ones separately. So, but if it is type 2 that you are diagnosed with, we always recommend lifestyle modification to see what you can do. Some doctors proactively already start you on insulin injection. Some, at their own discretion, will start you on different types of oral medication. So they will start you on maybe tablets that just help you to make your body more sensitive to insulin. That is the little amount of insulin that your body is able to make. They could also start you on medications that helps your pancreas to produce more insulin and make it available for you 24/7. There are so many things most of the oral medications could do for you. They could start you on the new generation oral medication that help your body look after the sugar. They could also start you on the new generation non-insulin injectables, which you could inject once a day or you could inject it once a week. Those ones are really wonderful as well. They help your body manage blood sugar. We will go into details when we address all these medications individually. Some doctors might start you on injectables, the insulin. Insulin, we already know, the body produces it, is a hormone to look after the sugar. Sugar, we already know, are the end products of when you eat any starchy food like rice, potato, pasta, yam, and all the rest. So when it's broken down to sugar, insulin is the hormone that the body releases to take away the sugar and drive them into the cells for you to use them as energy. In this case, the doctor might recommend that in addition to whatever amount of insulin your body is producing, they will give you insulin injection to support. They could say you take 3-4 times daily insulin. That means you take the long-acting or you take the rapid-acting. Long-acting, you take it whether you eat your food or not. Rapid-acting, you take it only when you eat your food. So those are the approaches that they might use for you to manage your blood sugar. The doctor does individual assessment and know what works for you. There are very many things they take into consideration. They could look at your pockets and know what type of insulin you can afford. There are so very many of them in the market, which we will address as well. They might find a cheaper option. They will tell you the side effects and how to manage that so you don't get into trouble. They might choose to give you tablets because that's what you can afford. And that tablet, it will depend on the one you can afford. They might choose to give you a particular type of medication and a particular type of tablets because of your body function, because of the organs in your body. How is my kidney going to tolerate this? How is my liver going to tolerate this? What is my existing health condition? Does this go well for me? So these are the things you must make sure you discuss with your doctor. They don't just recommend a particular medication and send you home. You have to ask them, what are the reasons behind suggesting this particular tablet, this particular injection? The doctor, nurse, or the pharmacist, or whichever healthcare provider is looking after you should be able to know you very well and know what works for you. It could be they need to know what type of life you live. What do you do for a living? Is this suitable for you given the type of life you lead? So they need to take those thorough history, and based on that, they will come up with the management approach that is best for you. You need to make sure you provide all this information. When you go home, you tell your family what type of management you are in. The most important to-go place is to always test your blood sugar. I have demonstrated how you test your blood sugar. It's only when you test that you know what to do. If blood sugar is always low, you let your doctor know maybe the particular medication you're taking is not good for you or it's too much dose. If your blood sugar is always on the high side, then you need to let your doctor know as well, and they can review what treatment you have. When all these things are balanced out, you maintain a normal glycemic control. If you maintain a normal glycemic control, the likelihood of developing long-term complications like blindness, like liver disease, kidney disease, like heart disease, like losing your lower limbs will be next almost impossible. But if you do not test, you're not gonna know. So if you are living with diabetes and you do not have a glucometer to test your blood sugar, I will recommend you do that today. Testing your blood sugar daily will depend on what type of medication you are taking. There are some oral medications you're taking, and you will need to test maybe once or twice a day, maybe every other day. It all depends. If you are on insulin injection, or maybe 4 times daily injection, you might need to test up to 4 to 5 times daily, and even when necessary. If you're on once daily, you might want to test maybe once or twice. I will go into details about all these when we address a particular treatment approach. So this is just an introduction into the management strategy when you are already actively living with diabetes, be it type 1 or type 2 or gestational or any other type of diabetes for that matter. We will be addressing in the next episode different management approaches. The management approach is based on the assessment by your doctor, and they will take a whole lot of things into consideration. And based on that, a treatment approach is determined, and that must be something you're comfortable with and you're able to deal with. Till then, I'll say you look after yourself, and I'll see you in the next episode.